Ian Jackson, Patient Satisfaction, How to Access Outcomes, United Key Experience. Please give your lectures. Thank you very much.
Thank you very much, and thank you very much for the invitation to talk this afternoon. I can't see anybody out there unless I go like this, so I'll work on being blind. I've been asked to talk about patient satisfaction. Jan has dealt with the patient information, and perhaps this is more about what do we find out afterwards. Now, satisfaction can mean different things to different people, and I was trying to think about ways of introducing this talk, and also ways of providing something that perhaps you might help remember what we're talking about. And unfortunately, there's no volume on this. But you might get the idea that that is a Swedish advert from IKEA that suggests that your bedroom should be kept tidy, lest the children find something they shouldn't. Anyway, one of the reasons that I expressed an interest to talk about this today is because in the UK we've been using, or the government has set up a system that actually starts looking at patient-reported outcome measures, PROMs. And what this does is it actually calculates the health gain after surgical treatment by using pre-op and post-op surveys. And it's been set up in the UK, we're looking at hip, knee, hernia and varicose vein procedures, and it's been up and running since 2009, so we have some substantial data to look at. You might wonder, how does it work? Well, actually, it's run by the Department of Health, or a department of a sub-department of the Department of Health. And they are responsible for the analysing of the data. But each trust, each hospital that we work in, has to give these pre-op and post-op questionnaires to our patients as they come through the system. And we are judged on how many patients actually provide the feedback. So it is important to us to ensure that our patients do feedback into the system. To the extent, increasingly, there will be a financial penalty if we don't reach a certain percentage of patients responding. The scoring is a series of questionnaires, and all patients, despite whatever condition they're coming for, are asked to complete a common set of questions about their health status. These include things about their home circumstances, any chronic conditions that they have, but also it uses the EQ5D health questionnaire. Now, I don't know about you, but I didn't know anything about the EQ5D health questionnaire until I went to look it up. The 5D stands for 5 dimensions. So the questionnaire asks a series of questions that looks at the mobility of the patient, how able they are to look after themselves, what their usual activity levels are, and how much pain and discomfort they're in before the operation and after the operation, and also questions that give an indication about degrees of anxiety or depression. There are other scores within the system, so obviously our hip and knee patients have their Oxford hip and knee scores completed, and the varicose vein patients have the Aberdeen scoring system applied. But also, in the post-op questionnaire, there's a series of questions that tries to pull out information about any problems that the patient has experienced, whether that be allergies or bleeding or wound problems, or even if they were actually readmitted since the operation, or whether they had a further operation on the same part of their body. So trying to get data about the degrees of morbidity following surgery. And the data is regularly published and is freely available in the public domain. So if you search PROMs on Google, you will have access to all the data that's been published for England. One of the most recent reports was called Satisfaction and Success of Surgery for the years 2010-11. And these reports provide data at hospital level. So each hospital can be benchmarked on how well they're performing. And that's an important point in the UK as the Department of Health is increasingly looking at how we benchmark activity. And so here are a sample of some of the results from that report. And you have to look at the question carefully, so I've put it out in full because that influences what the patient might reply. So how would you describe the results of your hernia operation? Well, basically, over 91% rated it good or above. That's interesting because I'll come back to that. Overall, how are your hernia problems now compared to before the operation? Again, we're getting over 80% reporting that it was much better. So for hernia surgery, it does seem that our patients are making a health gain having had the procedure. Knee operations are, I don't know about in your country, but certainly in the UK, we feel that the patients do make gains, but they do experience a lot more discomfort after a knee operation, and sometimes the results aren't quite what they were looking for. So it's quite reassuring to see in the UK that if you were asked them, how would you describe the results of your knee operation, 82% reckon it was good or above, with the largest percentage, over about 33%, saying it was very good. And if we ask them overall, how are the problems now in the knee on which you had the surgery compared to before your operation? So the wording's quite important, but you say that something like 68% feel that it's much better, and another bit, about 18%, a little better. So it's just interesting. That would fit more with my feeling about knee surgery, that not everyone actually thinks that's hugely better afterwards. I had a look to see, just to give you a sort of a feeling for the number of patients involved in this process. And so if you look at the current 2011 and 2012 data, which is still provisional, there's nearly 250,000 eligible procedures being completed in England, because this only applies to England. And so so far, there's over 184,000 replies to the pre-op questionnaires. So that's nearly 75% response rate from the general public, which I think is pretty good. And I think as trusts are judged on our response rate, we are actually asking patients to return these questionnaires and expressing the importance of this. And I think it's a bit like, we're actually getting a bit like, I don't know, has anybody bought a car recently or taken their car in for a service? When I take my car in for a service, I get told that actually Audi might ring me up and ask about how well they did. And they ask me, you will be able to say that you did well, won't you? And I think increasingly in this consumer society that we are in, people are looking at trying to get positive feedback. So far, with the post-op questionnaires, there's about 76% return rate, but there's still time on the 2011-12 year, so we'll see if we manage to reach the same as the previous time. Now, this is an interesting table from the most recent results, and I show this one because it puts a slightly different picture on things. So those with the dark green bands going to the right are those who say they saw an improvement. Those who have the light green bands going to the left are the percentage who feel that they were worse off. Now, there's one score in there, the EQ-VAS, that consistently seems to come up against the rest of the information that I've been showing to you. And so when I looked at this, what it is it's a visual analog scale, a vertical 10 centimeter visual analog scale, asking about their overall health status. And there's when you look in the press, there is a lot of question marks about the validity of the question or how it is being put, because in this one area, it seems very different and contrasting to the rest of the results. So there is further work being looked at that. That's not the end of it in the UK, because we're just entering into this new scheme of revalidation. So all doctors in the UK have to complete a cycle of revalidation every 5 years. We've been revalidated informally for many years, but we have to have a series of 5 yearly appraisals. We have to produce a 360-degree feedback account from the staff that we work with and colleagues, and we have to produce a questionnaire from the patients that we treat. So we have to, during that 5-year period, do at least one survey of our patients of a reasonable number using a questionnaire. And the General Medical Council in the UK has produced a questionnaire for us to use. And just to give you an idea of the sort of questions that are on there, the question number 4 is, how good was your doctor today at each of the following? And you can the patient can choose between poor all the way up to very good. And the questions, the subheadings, just in case you can't see them, include being polite, making you feel at ease, listening to you, assessing your medical condition, explaining your condition and the treatment, involving you in the decision-making about your treatment, and providing and arranging the treatment for you. So there's quite an extensive questionnaire of the patients there, but then it goes on. They're asked to decide whether they feel that the doctor will keep information about me confidential. So do they trust you? And the second part of that is, this doctor is honest and trustworthy. And they have a choice between strongly disagree and strongly agree. And then finally, they have a series of 3 questions. I am confident about this doctor's ability to provide care. I would be completely happy to see this doctor again. Was this visit to your usual doctor? Was the final one. So it's to get an assessment whether you knew the doctor. So we have a huge amount of information now going back to our powers that be about patients and what they feel about the procedures with the PROMs, but also about the medical staff and about the consultants and the trainees that they have seen during their visit. And I think this is just the start. So I mentioned that trusts are now able to be benchmarked on the outcomes of their hip and knee and varicose veins and hernia surgery. I think that's just the tip of the iceberg. I think we will be going down to consultant level in the UK, providing reports on outcomes and on patient satisfaction. So that is my picture for what is happening in the UK, and thank you very much for listening to me.
Thank you very much, Jack. Please, I would like to call